mother called me to her bedside. These words she said to me: if you don't quit your rambling ways, they're gonna get you in the penitentiary. Gonna get you in the penitentiary, poor boy. Gonna get you in the penitentiary. If you don't quit your reckless ways, they're gonna get you in the penitentiary. So I sat myself down.
Continuous passive motion, or CPM, is a post-operative treatment method that is designed to aid recovery after joint surgery. In most patients, after extensive joint surgery, attempts at joint motion cause pain, and as a result, the patient fails to move their joint. This allows the tissue around the joint to become stiff and for scar tissue to form, resulting in a joint which has limited range of motion and often may take months of physical therapy to recover. Passive range of motion means that the joint is moved without the patient's muscles being used. Continuous passive motion devices are machines that have been developed for patients to use after surgery. Applied postoperatively, this device may be used on an inpatient or an outpatient basis. By using a motorized device to very gradually move the joint, it is possible to significantly accelerate recovery time by decreasing soft tissue stiffness, increasing range of motion, promoting healing of joint surfaces and soft tissue, and preventing the development of motion-limiting adhesions, which is scar tissue. Interestingly, this is accomplished without patient effort, passively, as the machine moves a joint through the defined range of motion for an extended period of time. Even more surprisingly, studies have shown that patients using CPM devices require less pain medication than patients who have had the same type of surgery and are not using the device. This is my CPM machine here. I've identified a few usability issues with it. First off, it has to go through a full range of motion. So what this thing does is it passively moves my knee with a motor. Now it's at 0, and it starts to gradually give my knee more angle, which helps stretch it out. And it has to go through an entire full cycle before I can shut it off. So if the power goes out, or if there's an emergency, I'm stuck in this position until help arrives, pretty much, if I'm home alone. I can stop it like right here, but there's no way for it to release and go back down to 0, which is the most comfortable position to get my leg out in. Like I said before, if the power goes out, it freezes right in place. There's no release. So, I mean, it's happened a couple times where I've just been in excruciating pain because of the angle, and I couldn't get it down. Another usability issue with this product is the weight. It's extremely heavy and cumbersome to move, and especially for elderly people or people with disabilities, it's a real hassle to move this thing. And the last usability issue I've identified with this product is that the power cord and power button are way down here at the bottom. I can't even reach it. And I mean, I have a stop and a start button with this remote, but there's no power button to turn it off with. So it can waste, electricity, or it can just be a general pain user. If that plug comes out, I'd be in trouble. Alright, thank you for watching my video.